so you're quite right.
21/6 on Thursday. Has to be.
The clock's just over 10 o'clock, so good morning everybody. Welcome to the February Health and Scrutiny Overview Committee. I'm Councillor Steve Charnley chairing for those who are online. So the first item on the agenda is apologies for absence. I've got David Minnery, for who Robert Tind was meant to be substituting, and Gerald Dakin, who we've got Roy Allcroft in the room substituting for Gerald today. I think that's all of them, so we'll move on. And item 2 is election of vice chairman. For those of you who were here in November, we did actually elect a vice chairman in Councillor Dan Thomas, but it wasn't actually on the agenda, so we have to rerun it, unfortunately. So can we have nominations for vice chairman? I propose Dan Thomas. Any other nomination?
Can I nominate Councillor Heather Kidd, please?
You certainly can. No other nominations, so we'll take those in favour of Councillor Dan Thomas to become vice chair. Start with, please. Show. 3, 6, and those for Councillor Kidd. 3, so that's carried for Councillor Thomas. Congratulations on being vice chair officially. Thank you. Item 3, disclosable interests. So as per normal, it is up to the individual to declare those as we go through the meeting, and if you have an interest to declare. Item 4, the minutes of the meeting held the 22nd of November, which seems an awfully long time ago, but they were circulated, so is everybody happy that they're a true record? Can we have a proposal and seconder, please? I'll move. Nick. Okay, thank you. All in favour? Thank you. Item 5, we have public questions. We've received 2 questions from Jill George, and I think Daniel, you're going to read those out.
Thank you, Chair. Daniel Webb here, Overview Scrutiny Officer. Jill George's first question is entitled Bishop's Castle Community Hospital. Bishop's Castle Community Hospital was closed by Shropshire Community Health Trust on the 15th of October last year. A Bishop's Castle resident issued court proceedings arguing that the organisation had failed in its duty to involve the local authority and the public. Prior to a court hearing, Shropcom acknowledged that it had acted unlawfully and quashed its decision. The Trust claimed that it had acted on safety grounds, but has not produced evidence of this, and Shropcom law papers, including quality and safety reports, do not show a history of safety concerns at Bishop's Castle. Will the Health Overview Scrutiny Committee seek assurance from Shropcom leaders that there will now be a robust involvement of both the Health Overview Scrutiny Committee and the public? As this takes place, will the HOSC, the Health and Overview Scrutiny Committee, be particularly mindful of the needs of Shropshire's rural communities? The Clinical Commissioning Group intends a review of all its community beds for the next financial year, and in a context of scrutiny type finance, rural services may well be seen by NHS leaders as an unnecessary luxury. This will be to the detriment of rural communities.
Thank you, Daniel. And we have Rachel Robinson, Director of Public Health, in the room. I'll just give her a minute to catch up and log on. Giving a full response.
Yes, apologies, Chair, for being late.
So the response that we have, the committee would like to thank Ms George for these questions on these two important issues that the Health and all Adult Social Care, All View and Scrutiny Committee is committed to exploring. Bishop's Castle Community Hospital. At the meeting on the 22nd of November, the committee did at length discuss the temporary closure of Bishop's Castle Hospital. The committee recognised that there is a very significant interest in the current closure of Bishop's Castle Hospital, both from members of this committee and the public. The Community Trust representative, Chief Executive Patricia Davies, joined to answer some initial questions from the committee. We understand that the Trust has also followed this up with further discussions with local friends of Bishop's Castle, patient participation group representatives and local members in the Bishop's Castle area. The Trust have agreed to continue to update councillors in the area routinely on a roughly fortnightly basis, as well as to include them in any ongoing meetings, workshops, communications with local people. At the same meeting, it was confirmed that the Bishop's Castle Community Hospital would be brought to a future meeting or an extraordinary meeting of this committee. This was originally scheduled for January, but was delayed due to Omicron. The committee requested a copy of how the work plan, an indication of how the Trust will work alongside the local plan, and a detail on how all the parties will be involved in the future. The committee will consider that the rationale behind any decision to be assured that services are to be provided by alternative means, that the impacts of any proposals are assessed for their impact on local communities, including taking inequalities and rural issues into consideration, and consultation is robust regarding the closure or any reconfiguration or reopening of services. In response to the second question, shall
I read the The second question is entitled Ambulance Services. The Health Overview and Scrutiny Committee will be well aware of the current crisis in the ambulance service. This reflects a wider crisis in Shropshire's health and social care systems. Councillor Leslie Picton has described the local NHS as broken and has commented that government funding does not recognise the extra costs of providing services in a rural area. For Shropshire's rural communities, there is a double whammy. This follows the 2018 end of ambulances being based at Ludlow Hospital and the running down and eventual closure last year of the rural ambulance stations at Craven Arms, Oswestry, Bridgnorth and Market Drayton. A majority of ambulance call-outs still result in conveyance to hospital, usually to Shrewsbury or Telford. This means that rural 999 callers will typically have an additional 40 to 60 minutes added to their ambulance response time, with significant consequences for life-threatening emergencies. Will the Health and Overview Scrutiny Committee consider a fact-finding project on the provision of ambulance service in Wales? Is it of note that the Welsh Ambulance Service operates from over 90 ambulance stations? Will the Health Overview and Scrutiny Committee give serious consideration to support for a Shropshire service that treats rural communities more equitably, recognising the importance of distinction between equal and equitable treatment?
Thank you. And the response to that second question. At the full council meeting held on the 13th of January, members noted the worsening of ambulance services in Shropshire over recent years, despite the best efforts and dedication of ambulance staff. That patients are dying waiting for an ambulance in Shropshire. Queues of ambulances at both the Royal Shrewsbury Hospital and the Royal Princess Royal Hospital because there are no beds available for the patients. The council resolved to lobby the government to create an independent ambulance service for Shropshire that will prioritise the needs of a large rural community. The council supports the Health and Wellbeing Board to facilitate improvement dialogue between WMAS and staff, with the objective of drawing up an action plan with completion dates so that the number of ambulances queuing outside hospitals is reduced. A petition was also presented to full council held on the 27th of February regarding an ambulance hub in Ludlow. This received unanimous cross-party support to support our campaign in returning an ambulance hub back to Ludlow, South Shropshire, or the return of a local rapid response vehicle which can be on call and based at local areas like Ludlow Hospital, GP surgeries, fire stations, to attend until an ambulance arrives. This committee will put your questions to the Health and Wellbeing Board to include in its lobbying for an independent service and request an update on the work to date. The committee will also discuss with officers how it will scrutinise the work, but also of the current service in terms of the equity of treatment and the outcomes delivered for the people of Shropshire. A full response will be given at a future meeting.
Thank you, Rachel. Moving on, item 6,
Can I ask, Will these answers be circulated, please?
Yeah.
Yeah.
Items of members' questions, we have none. So moving on to item 7, which is health and all policies, which is a important one. And once again, Rachel, you're leading on that one. Busy today.
Yes.
Busy every day, but.
So thank you, Chair. So this, I have my colleagues who, you can see Sue's online, who'll be dialing in to support this paper, but I just wanted to give you a bit of an overview of it. So health and all policies, as you'll know, was adopted by Cabinet in February 2020. And it's really an important policy across the council that is underpinned and tries to ensure that health and wellbeing is in everything that we do. So all policies or papers that we produce, we consider where possible the impacts on health and wellbeing. And that is what we're trying to do with this approach, is to take account of health and wellbeing in any of our policies and services, to avoid and reduce any impacts in terms of negative impacts on people's health, and to try and improve outcomes where we can, so to mitigate any of those negative impacts that policies might have on health and wellbeing. And this policy really aligns to our draft vision now, which we have, which is to live the best life and support healthy people and healthy economy and healthy environment within Shropshire. So we committed back in February 2020, there was a number of recommendations that Cabinet approved, including a phased rollout of the adoption of the health and all policies. There was also, and committed to some training, and this paper really is an opportunity to bring you up to date where we are in terms of our health in all approach. I would just say that obviously, whilst we brought this to Cabinet in February 2020, clearly there was a lot that happened in the last 2 years, which has prevented us moving some of this areas of work forward at the pace that we would have liked. So what we've done is we restarted the work back in July 2021. Had Omicron in the middle of all of that, but we wanted to bring you an update on how we were trying to move this programme forward. And as I said, clearly the pandemic we've had within the middle of all of this, but actually I think that has given us an opportunity to understand health and how important health is, and our wellbeing of our local residents, and all of the work that the council does that supports health and all. So I won't go into any more detail. I'll probably hand over to my colleagues if that's okay, just to give a bit of stats of the paper, and then what we wanted to do is start bringing some work to Scrutiny, the work that parts of the council are doing to try and embed health and all in the work that they are doing, and I hope that this is the start of a programme of work that we'll be able to bring forward before Scrutiny that you can look at to make sure that we are indeed in some of the policies where we think have the biggest impact on health and wellbeing, that we are scrutinising those policies and making sure that we maximise health benefits and minimise any negative benefits. And that's the first piece of work that we're working through. We'll bring that through to you today. So I'll hand over to Sue, who I think will probably give a little bit more information.
Yes, Sue's online.
Thank you, everybody. Thank you, Chair. Thank you, Rachel. Yes, a healthy population is an economically active population, so we're very much working towards embedding health in all policies. I'll give an overview of the progress we've made to date, and we've also invited our colleague Steve Brown from Transport to make a short presentation, so Steve will follow me. To date, we have, as Rachel says, picked up from the 21st, from July 2021, and we've particularly been focusing on building capacity within Shropshire Council internally, within the Health in All Policies agenda. So we've been introducing training to develop health impact assessment, but also awareness training for our colleagues, and very soon we'll see a Leap into Learning module online. We've also introduced a screening process for all policies and strategies that go to committee. You'll probably be aware of the equity and social inclusion screening process, and to this we've added health, and our objective is to mitigate any negative impacts of health within policies. And hence our work with Transport currently. We've introduced a web presence, and we're also working across many of our partner departments including housing, including our adult social care colleagues as well. We're planning over the next 12 months to further develop the capacity internally, but also to ensure that we are working very closely with teams that are delivering policies and procedures. And one of the major policies that we're working on at the moment is the transport policy. And we've been working extensively with Steve and the team in the development of LTP4. So I'd like to invite Steve at this point to talk about the work that we've been putting in place jointly.
Over to Steve.
Okay, thank you, Sue. So there is a presentation which should be loaded up for members already to see.
Can I check, Daniel, if that's available, or I have one on my screen if you'd like me to?
I don't have a copy. If you could share that, Susan, it'd be great.
Yes, of course.
Okay, thank you, Sue. So I'll talk you through this presentation. This presentation will give you an overview of the local transport plan for Shropshire, its interaction with the work on health in all policies, and the work that we're doing across sort of public health and health in its widest sense to embed this work in this important area of work. For those of you that are not aware, the local transport plan is a statutory plan. It is required. Shropshire Council has to produce this, and we're in the process of this being developed with a target date of presenting a draft transport plan to Cabinet in the late spring, early summer of this year, and then at that point asking permission to go out for full public consultation. So this presentation gives you some of the background work that's being undertaken in that process. So we understand, and obviously transport sort of understands and acts as a conduit and acts as a catalyst to everything to do with the sort of impacts on the economy, impacts on health. We're sort of aware of, you know, the issues, especially in some of our more rural counties with the bus service, with access frequencies and the quality of service there, and now that prevents people getting to further and higher education, and now that also can prevent people from engaging in economic activity, and also encourages greater sort of car use, you know, with all the issues to do with carbon. So one of the examples that we've got there is the wider determinants of public health are accessed by the transport plan, and that comes through sort of the health service, education, employment, but also linking into place, which is partly to do with well-being and social isolation, physical activity, air quality, and again that is an issue that where we've got 2 air quality action zones within the authority that we need to put some thought and action into those, and also into road safety as well. So where we have our statutory responsibility to manage killed and seriously injured issues and deaths on our 5,100 kilometres of network, also where we can sort of improve road safety and mitigate any sort of issues through the planning and delivery of works as we go forward. The next slide really sort of tries to pull all of this together. So the yellow box that you can see is the draft local transport plan that sits within the framework of the Shropshire plan, the local plan, the forthcoming local and cycling walking infrastructure, plan, and also if you almost imagine it like a Venn diagram sitting within that local plan, the economic plan, the communities and rural strategy, linking into sort of public health and all of those issues there. Underneath the yellow box, you can see some of the plans coming forward through Shropshire, whether that be the Big Town plan, the Oswestry plan, the bus service improvement plan, which again we help to bring that forward and support communities in that. On the right side, which is the dark boxes, you'll see the links into national policies. So the national transport plan to decarbonise and to support the council's climate change agenda on that. The government policy on Bus Back Better, sort of the mobility strategy and rural transport, and all of those links with March's left, Midlands Connect Chamber of Commerce, and all of those business and economic based agencies and groups that you would expect to see. So a lot of work has been done, as my colleague has said. We can sort of integrate local transport plan into health. So we've gone through a model of screening, of scoping, of undertaking the appraisal, and working together as a collective with across the piece and with external support to make sure all of those issues are understood, all of those wishes that we wish to bring forward are carefully considered. Bear in mind this is in the context of the draft local transport plan will be coming to Cabinet for approval as a draft and for wider consultation in the next few months. So it's in the development of that work as that moves forward, and also going back to some of the questions that have been raised this morning about equity of use and fairness and division of resources across the county. The health and impact screening assessment, asks direct questions, and it also considers any sort of potential negative impacts. And again, the status of the transport plan is a statutory document. It is legally required for the council to produce it, so it needs to be scrutinised, it needs to be considered, and its sort of impact on policies and issues across the board also need to be looked at. So questions such as, will it promote an healthy economy? Will it support economic recovery? What do our sort of government agencies and sub-regional agencies, what's their view on that? Have we talked to them appropriately? Will it support interactions and work with our colleagues in economic growth and all of those issues? So for members to understand, the plan is probably twofold. One, it will come forward with some direct and discrete sort of targets and actions that for the council to implement, assuming that it's approved, and also, we will be using it as a council, I'm sure over the next few years through a number of sort of different service areas and directorates, especially in the support of external funding, especially in the support of working with government and taking all of that external funding bids, and also policy support for any sort of issues or lobbying that we might wish to do with relative government departments. So the rapid impact assessment, looks and considers things such as leisure and health services, physical activity. One of the plans that we're bringing forward is the local cycling walking infrastructure plan. It considers air pollution. We've got air quality management zones within 2 areas of the county, and that is something that we need to be dealing with, and also road traffic injuries as well. And we have a responsibility for that, and we provide updates to Scrutiny as appropriate on that as we work through all of those issues. So back to the plan on the page. the object of the exercise of the transport plan is to pull all of those threads together, integrate itself into sort of Shropshire and national policies that are coming out from government, but also recognise and be cognisant of the work being done through public health, through economic regeneration, through the visitor economy, and through the sort of quality of life aspect that transport can bring. So the final slide really is the health impact assessment. We'll collate and review the evidence. We'll start to pull all this together. We'll start to look at some of these policies and issues and bring them forward within the local transport plan. And some of these policies and issues, you know, can be sensitive, you know, can raise issues and can raise concerns as well. So we need to be aware of that. Look at the data and collect all of that and the evidential basis for making any said decisions, and look at the health outcomes as well that it's trying to promote. So, and then overall is the review and engagement that's ongoing, and that's embedded with LT people going back to over a year ago when we started talking to certain groups and community groups, talking to SALC, talking to other representative bodies just to get their sort of feel and get their input into the development of this, and then as LTP4 progresses, then that engagement will go. And one of the examples that we did with that was we delivered a workshop to over 50 members just before Christmas on LTP4, just to sort of test it and to make sure that its sort of views and its current direction was aligning. So there'll be a lot more work to do on that as we progress over the summer period. So I hope you found that presentation of use, and if there are any questions, either myself or other colleagues will be happy to answer those.
Thank you, Stephen and Sue. It is very, very informative. It's if you're an outsider looking in, you would think that transport is all hard roads and tarmac for this. It is interesting to see how health, you know, weaves its way through that particular area. I've got 3 questions so far. So first, Nick.
Thank you, Chair. I may well have missed something, and forgive me if I have. I don't want to ask a silly question because I have missed something, but it seemed to me that Steve's presentation, as you would expect, was rather slanted towards transport planning and everything that goes with that. There was on one of the slides up in one of the corners a reference to the local plan and wider planning. Steve, possibly not the best person to answer the question, but I'm sure Rachel will be ready with a good answer. To what extent is the ordinary planning process going to be influenced by health in all policies? I mean, I happen to have a development management report for tomorrow's Northern Planning Committee in front of me. There's lots of references to ecology, lots of references to highway safety, of course, human rights, equalities, etc. No reference in this report to health in all policies. Now, I would have thought that that should be one of the standard things that goes into a development management report. And I guess it's perhaps a bit down the track, but if Rachel could expand, that would be very helpful. Thank you, Chair.
Yes, we're really happy to, and Sue will probably want to come in as well after. So yeah, so the process that we put is obviously a phased process, so that's what we took to Cabinet and recognised that we couldn't do everything at once. So we would take a very phased process to implementing some of this, because actually most of what the council does, if you look at it, can have an impact on health and wellbeing outcomes, absolutely, like you said. And so what we wanted to do was build up capacity for people to be able to understand the impacts of health and all that they're doing, which is the training programme, build up a screening tool, which is what you're talking about in terms of putting that into documents, so that every time that a paper or policy or anything goes to a particular committee, we're asking the people who are putting that paper forward just to consider, does this impact on health and wellbeing, and consider some of those issues. And then, as Sue said, for those bigger bits of work, we've got a screening tool that we go through and say, actually, do we need to do a full-blown health impact assessment on this because the impact is so great? And that's what we're doing in the case of health, the transport policy, the local transport policy. So some of this is phased, and we won't see it rolled out across the council at the speed that we would like, but eventually everything we do, we certainly would expect people to be considering the impacts of health and wellbeing, but we've got a process to go through first. And as Sue said, one of the things that we have done is implement that board, that paper where we're asking people to think about, does this impact on health and wellbeing? But there is some understanding, training and capacity we need to build up there, because health is very broad and not everybody sees health and wellbeing as being that broad. That being said, actually in terms of the local plan, that was one of the first pieces of work when Sue started before the pandemic that we tried to get very involved with early on in the broadest sense, just to make sure that we were considering health and wellbeing outcomes very broadly in the plan, and that was kind of a precursor to us getting this formally through Cabinet to be agreed. So Sue might want to talk about some of that specific work, but we did get involved at that point in terms of the overall plan to make sure that we started to think about how we could make sure that it benefited health wherever possible. And whilst we can't prevent all negative things that impact on people's health, what we always try and do is mitigate and put actions in place that will mitigate them. So in the transport plan, the example being air quality, we know that air quality has a negative impact on people's health. Clearly, we can't stop all air pollution, but by using the local air quality management areas and others, we can start to mitigate some of those. But I'll stop talking now, because we might be able to give a little bit more detail on the local plan to answer that.
Yeah. Just a little bit more on the local plan. As Rachel said, we did talk to our planning colleagues extensively as the core plan was being developed, and particularly around green planning. So we have embedded health within the green planning. However, it may not be termed health per se, but of course the outcome is improved health, particularly with the green highways. Also, this is an ongoing process, as you've alluded to, and in fact next week we are meeting with the place-based directorate to discuss the prioritisation process going forward, which will include planning, obviously, and how we can further embed health in all policies through particularly place-based initiatives. So thank you for asking. Thank you.
Good, thank you. Next, Heather.
I've got two parts to this. You want them both now?
Yeah, might as well.
If I start off with housing is not particularly well seen in this document. It actually affects health probably as much, if not more than many things. We, as we saw at council, have a huge issue with fuel poverty, which is greater than the West Midlands, 12.4% of our residents being in fuel poverty, and that is likely to get a lot worse over the next year. So actually, I want to see this more explicit in here. It also impacts on the local plan, it impacts on building regs, and you did talk about housing, our housing. Is that just our housing stock we're talking about, or are we actually looking to seriously influence our housing associations on retrofit and all the rest of this, and not just relying on gas, because the southwest of the county has none, no gas anywhere. So we have a significant problem. So all of those need really to be included in that, and it is possible for a council to influence building control and not just go for the basics in building control standards, because what we're doing at the present time is building houses at basic building control levels, many of which, the smaller ones, become buy-to-lets, and therefore are in the private rented sector. We have no control over that, and they are the fuel poverty houses of the future. So I'm really concerned that actually this is all pervasive, this work, and it really does begin to impact on all of that across everything. And we see every winter so many older people in hospital with chest infections because actually they're living in substandard housing. So the impact of this is not just on us and our adult social care, but also on the NHS across Shropshire. The second part of my question is about Steve's presentation. Has they worked at all with countryside? Because quite an important part of transport in the rural areas is actually footpaths and people being able to walk easily from one hamlet or one village to another one where the services are. And that enables people to keep fit while they're doing that. And I have regular requests for easy access to, say, Wortham from some of the hamlets. But there's no mention of that form of transport and that health here, and countryside is actually vital to most of those things because many of our roads, it is not possible to put a footpath in so that people can actually walk or cycle. It would be great if we looked at doing more of that, and maybe we could use some of the ELMS funding or work with farmers around that to actually enable it. But it is part of transport despite being on foot or on a bike.
Yeah.
And the other little thing about the whole of that was I was far from clear how that was rurally proved, and that actually you talk about rural, but actually how it's going to deliver for some of the more remote rural areas, which can easily yet again be left out and left to put up with what they've got at the moment, which is far from good for health in any form. Thank you.
So if I pick up the first part of the question first around housing, that's okay. So absolutely, I mean, the next part of the plan, if you like, is the forward plan. And as you said, housing is a fantastic example of something that the council is really heavily involved in, influenced. It's not just our own stock, as you said, other stock, that we can have a really strong influence in making sure that we deliver the maximum outcomes for people's health. So that's part of the forward planning. I think the reason that we started the local transport plan, because it's opportune, we can't have the plan being written without considering health and well-being in it, and it's very much a learning. As we go through it, we're training, literally training on the job, and training staff up. And the best way to have enough capacity, we need to train everybody to understand health and well-being, to be considering this just naturally as part of what we do. So we talked about the planning process before, we talked about housing as relevant. What you want is officers to be doing as they're doing this work, to be considering actually, is the health issues that are going to arise because of this, is the health benefits that we can maximise, and you want that to be a natural part of everything that comes through the council. So the forward plan will pick up some of the big issues, and I think housing is a really good example. That conversation with place that that Sue talked about will be really, how do we prioritise this, what's coming up now that we can influence, and then there probably will be some retrospective work we have to do to go back and look at current policies. But at the moment, the plan is to get involved in those policies as they're arising, so we can really influence as early on as possible. I think so that's what I would say. You're absolutely right, and I think what we wanted to do with Scrutiny was to start bringing some of these back, so that actually we can, when we're looking at something around housing or we're looking at the local transport plan, we can bring them here, and as a committee you can consider, are we doing enough, are we picking up the right areas, is there more we need to do, and as a council, are we really embedding health in everything we do, recognising that we're very much at the start of this and it's being delayed, unfortunately. The second part of the question, so if that's okay, is that okay on the housing? I really want, and then I was going to probably let Steve answer the local transport plan, if that's okay.
Okay. In response to Councillor Keith's questions, well, it's a multifaceted response really. So there is an LTP4 project board, and colleagues from Leisure and Culture and Countryside Services sit on that board and are active participants in shaping of the local transport plan. We're bringing forward, as part of the local transport plan, a local cycling walking infrastructure plan, and as part of the government sort of changes now, the hierarchy of sort of transport users now does include walking and cycling, and that is that has been undertaken, and the creation of Active Travel England as well, that will be sort of coming to being over the summer, and will be in some respects similar to Ofsted for transport, to make sure that these issues are being looked at and being considered. So again, the transport plan will do sort of two things. It will bring forward discrete targets that we'll be able to look at, manage, scrutinise, and be transparent post approval, but it will also bring forward policies for other areas of the council, or for us as a council to be able to sort of bid, and compete for national funding initiatives as well, in order to sort of make some of those improvements. So that's part of that issue.
Can I just have reassurance about the rural proofing, that actually we don't hit all our targets by doing this in the urban areas and not in the rural areas where our health issues are, as you've heard from Bishop Castle Hospital and all the rest of it, quite desert-like. And actually we don't need to be a desert for the healthy options as well.
Yeah, if I could come in there, Chair. Part of the health impact assessment process is to absolutely represent all of the populations and communities that we're serving. And so what we're looking at in terms of health and the transport policy, particularly at the moment, is the evidence base that supports the best way that we can work with Steve and the team and improve transport in terms of health in rural environments and urban environments, but rural is absolutely one of the criteria that we've applied when we're looking at the evidence. Thank you.
I will look forward to the scrutiny of it.
Thank you. Chris?
Thank you, Chair. I was just wondering why we've got Steve with us. With the climate change crisis and everything, how does that fit in? I know you showed a couple of slides there. How does it fit in with health and well-being? I mean, are we looking at having electric ambulances, or could you give us some examples, Steve, of how it fits in?
No, Steve.
Just to give Councillor Schofield some specific examples. So on the slide within the presentation, there was the plan on the page side. So part of that is there is national policy, which is the decarbonisation of transport. So that is one of the requirements that we will need to consider. The council's own sorts of policies to do with climate change and decarbonisation will need to come through as well. Department for Transport changing the guidance. We know that they're going to do that, but we don't know when they are going to do that. But that guidance will require significant targets within local transport plans for decarbonisation as well. And yes, the sort of change to electrics and all of that will come through. So all of those issues will be in there. Some of those will be problematic. Some of those aren't always in the council's gift to fix or to put right, but we can act and lobby on that, especially for the direct network operators that supply all the electricities and the different electricity phases to support electric vehicles. So we're aware of that. We're cognizant of that, and we're bringing those issues forward and making sure that that blend of sort of Shropshire-based policies also reflects national policies as well, and those impacts.
Okay, great. Kate?
Thank you. Can I just say I really welcome this. It's really nice to see health being put at the forefront of the policies in the council. My question's about the process, I guess. So, for example, does it have any teeth? So, for example, if there was something like a large road building project that was going to dramatically increase car usage in the area, maybe have large developments with housing that are a long way away from town centres. Would it simply be that there would be a mitigation process put in place, or if there was real concerns about impact on health, would that something further happen? So that's my first question. And my second question again is about the process. I really welcome. I don't wish to appear negative about this at all, because I think it's a really positive step. It sounds like what you're doing is you're in the early stages and you're training policymakers. Are there any internal checks and balances? Because as with every new initiative, there'll be some people who are more interested than others and may choose perhaps to downplay the impact on health on something, on a particular policy they're really keen to to push through?
Thank you, Susan. Thank you for that. It's a really good question. So I think the first one, you talk about, I guess, in terms of teeth. I mean, it's a very new, it's a very new process, obviously, that we're going through. And in any development or anything that's being done, there'll be a number of considerations: health, climate, there'll be economic, a bit like the pandemic. I guess we're always trying to weigh all of these up. But my anticipation would be that if significant health concerns were raised and they can't be appropriately mitigated, we would need to have a wider conversation around those issues. So, but I think but that has to be done, and we would have to do that through obviously part of the thing reason we wanted to do this is through members, through scrutiny, other areas obviously through the executive and the council processes. So there will always be negative benefits, and you can't mitigate all of them. And I think it will be that wider conversation, because there has to be that wider balance, doesn't it, and alongside all of the other issues. And that is what a full impact or an integrated impact assessment should do, where you're looking at some of those wider determinants of the economic, the mental health, the housing, all of those benefits have to be weighed up alongside each other. It's a really good challenge, good question, and I think the commitment to the process means that we have to take that seriously. And we need to be able to have all of that dialogue and conversations and come to consensus around it. But it's part of a bigger piece, I suppose, is what I'm saying. And I think flagging those issues and being cognizant of them and mitigating wherever possible. And I think your example is when we can't mitigate everything. Does that mean that the other benefits outweigh those, and we have to find another way to continue to mitigate? I guess is the question. So I think we need to absolutely bear that in mind, and these processes allow us to do that. I think we put in place. The second was, sorry, I forgot, it was again around the process. It was around, sorry, can you just repeat that? I didn't make
Yeah, it was around the sort of internal checks, maybe you're training the staff, policy making staff, but is there something at a digital level?
Part of what we're trying to do is establish a core team. So Sue, and we've got another officer, and trying to build up that capacity as a core team so that we can look at some of those. There has been, with the new board papers that have gone through already, a couple of those we have gone back on and just said, actually, we can see that officers perhaps haven't understood the benefits and some of the things that we're trying to understand, and it's not perhaps coming from, they won't look at all the health and wellbeing outcomes. So that working alongside the team who can support will be the way that we will look at that. So yes, we are trying to build in checks and balances into that. Also be proportionate, because we don't want this to tip everything over. We know that we're obviously considering climate. We need to consider all of this in all the policies that we have. And this isn't about grinding everything to a halt. It's trying to take forward, as I said, where everybody considers health and all. So there is a system in place internally. We are trying to train more and more people. We've got support at the moment from our Welsh system, which is again about trying to get us trained so that we can do that. There'll be the Leap into Learning training, which again will allow people to continue to understand some of these issues. So that's the process that we've set up at the moment. Unless I don't know if Sue wants to add anything else to that, or
The only thing I would add to that is that we are working with our HR colleagues so that the health in all training will become part of the essential training package. So it will be an induction training process. And clearly we're working across the council to embed health within the Shropshire plan. So there are internal checks and balances in that way too. Thank you.
Okay, Adam, come back to you.
Just as a point of interest, coming back to the whole retrofit thing that went through council, did we do an impact study on that? And will it be targeted at people, particularly in poor housing, that have hospital and so on because of that? Because that would be the sensible thing to do with that. And it would be a really good outcome for embedding this policy, actually, to see how it works. And it would be great if we could scrutinise the impact of that retrofit and what it made, what difference it has made in the future to people's health.
I'm going to ask Sue if you can come in on that one.
Yes, thank you. Thank you, Councillor. We were actually working with Paul Kelly and the team who were supporting the retrofit and also fuel poverty. We have, under the substitution processes, worked with them on key performance indicators that will show us if there is improved there are improved health outcomes, and we can bring that information to you, but we also want to embed that going forward. So our forward planning will very much be around housing and around other priority aspects that we're working with in terms of the place-based work that's ongoing.
It just would be useful evidence, I think, and it would be very real evidence for some of that. So it would be, and why we should do better things in the future with existing stock and so on. It just occurred to me. So it is embedded in that scheme.
Yes.
Will they be prioritising people who are having particular health issues?
In terms of prioritisation of health issues, I'm not sure that Paul's scheme has prioritised those specific individuals. We were very much looking at the outcomes rather than the inputs at that point. It was just before the pandemic, so I have to forgive the hiatus between then and now. But we will go back to Paul and speak to him around this particular piece of ongoing work that they're delivering.
So much a bit too early to give that specific feedback, I think.
Yes. Yeah.
It is, and I ask for the future.
Yeah.
The point is that actually, if we have people who are having falls or chest infections and being admitted to hospital, but they're living in fuel poverty and poor housing, it would be good if we were targeting them so that they don't continue to go to hospital.
Yeah.
Yes, Chairman. Just on housing associations, agencies and letting agencies, how is this policy going to, or how can we enforce our policy on them, or get them to agree to, should we say, cooperate with our new policies?
Yeah, so I think kind of, you're absolutely right. This comes, we're talking about in this, some of the internal policy that we've got kind of oversight of, and I've got an opportunity to kind of scrutinise and ensure that we deliver health outcomes. But I think that it will go across not just the things that we deliver in-house, but also that we can influence others around. And so as I said, moving forward, that is part of what we want to do in terms of the new vision around the Shropshire plan as well, in terms of influencing the wider economy and wider systems. So I think we have to show leadership internally first to get this right and to be seen to be embedding in all of our policies, but then we can use that to show the way in terms of some of the things we do internally that others could do as well. And as I said, influencing to ask people through the contracts that we have or through the leverage that we've got in terms of our leadership role. So I think that's how I would see it working out. One of the things, as an example, I wanted to come back to was, although we talked about health and all in the council, we've, I think it mentioned within the paper, we're trying to take a similar approach with our NHS colleagues. So I think ambulances, councillor mentioned those before. Well, with the integrated care system, we've asked that they look at impact assessment across all that they do. So clearly everything the NHS system do is about improving health outcomes, but we've asked them to consider the impact that things like the wider determinants of health, so the climate and the economy, can have on people's health, and benefits that can have in what they do. So we're trying to flip this policy in the NHS, in our integrated care system, and that's the approach that I would see us taking, with wider partners as well, so with wider businesses and others, to see what the benefits for them having a healthy sector in terms of their employees, but also in terms of thinking about health and wellbeing for the wider communities. And so that's, but it is iterative. It is very early days, and we need to start by getting our own house in order, I think, and taking this slowly and working through in particular policies where there will be an impact.
Okay, Health Watch at the back. Sorry, I've forgotten your name. David.
Mine's a very simple question as a representative for Health Watch Shropshire. I was just wondering, how are the general public going to be engaged in this new policy for health and all policies? How are the public going to be involved?
Yeah, and again, I think that's a really good question. So in terms of evidence gathering, when we're gathering evidence to understand the impacts that a particular policy will have on people's positive and negative effects. So the impacts that a policy will have on people's in a positive or negative way in terms of health. So we'll gather a range of evidence, and some of that will include information potentially from the public as well, in terms of engagement that's been taking place and what people are telling us. So we could do it through that process when you've got a full health impact assessment. In terms of screening, and that wouldn't necessarily happen all of the time, but it will happen in some policies. And in terms of some of the kind of more desktop, if you like, then it will be indirectly through gathering evidence that people have provided into various studies and different types of evidence to show where people have had positive and negative impacts. So some will be directly and some will be indirectly. Where there's a large piece of work where we have to do a really large integrated impact assessment or impact assessment, you would expect that we would involve engagement would be part of that with the public as part of that.
Okay, good. I think there've been some good questions asked. Just to sort of sum up, obviously we're at the start, well, not at the start, but the second start, if I put it that way. And there's going to be regular updates from different areas coming through. And I think it's up to everybody to keep talking about this, so it becomes an everyday thought process through things we do. But what's the sort of timescales for getting to the end game of this? So how long is a piece of string?
Well, absolutely, because it's an ongoing process. So I think what we've tried to outline is that we need to first of all do the forward plan, and we need to get that. We put February, but clearly we need at the end of February 2022. So in the next month or so, we need to bring a forward plan of the next range of projects and programs that we need to take through this process. The training we've scheduled in April that we want to start rolling that out, and I think that needs to be an ongoing process. It needs to involve members as well as staff, and we want to make sure that, and as we've said on there, so I think that needs to be an ongoing process to make sure that we really understand that. I think, and then obviously what we wanted to do, as you said, this will be ongoing, it will be embedded, it will take some time. The forward plan will be the check, I think, of whether we're doing that at enough pace, and obviously Scrutiny will have a view on is this going at enough pace, are people really implementing that, and as well as the discussion that we'll have through the group that we've set up, the officers who will be overseeing the process to check that people are really, it's not a tick box, because we're not doing this for a tick box, it's absolutely about making sure that we change this, but it's a huge ask, but yeah, absolutely, be through the forward plan. I think we need to bring the forward plan once we've drafted it back to Scrutiny, so Scrutiny are comfortable with how we're prioritising. We'll obviously have the training, and then we want to routinely bring some of these impact assessments where we've had to do a full piece of work back to Scrutiny, so you can see the progress that we're making, but also scrutinise some of the specific impact assessments we've done. Have we done enough? Have we hit the right areas? Have we made it? And are we implementing those? I think critically, it's one thing for us to tell us that we're going to do that. There's another thing for us then to follow through on those mitigations that we put in place.
Okay.
Can I just ask? I mean, part of that, which is exactly what you said, Rachel, is that we see and we can measure the impact of what we're doing, and the impact of this committee really does need to be measured because it's so important across our residents in Shropshire. So some of those impacts need to be built into those reports coming back so that we can measure for the future.
Definitely. Okay, so I think we've exhausted that one for today. Moving on, item 8 is the work programme. Daniel, what have you got to tell us?
Thank you, Chair. Daniel Welby, the screening officer. Let me just bring up my copy of the draft programme. This should have been included in the papers. There are a few items coming up in March to bring your attention to, and we need to have a general discussion as well around the findings from your meeting last year. I've just put a set of date round circulation for a briefing session on our joint commissioning arrangements and with our new Assistant Director of Joint Commissioning, Laura Tyler, on the 24th of March, in anticipation of bringing this topic to scrutiny on the 28th of March. We're also going to be bringing the winter plan findings to the committee. This will be, this was actually originally briefed very much as a lessons learned item going forward. The officers have supplied their lessons learned log from 2020-2021, and they're going to, I've asked them to sort of focus in the first instance on how they implemented those and the success in doing that, rather than a more reactive response to the recent pandemic. but obviously you're in charge. So if you have anything else you want to focus on that, then please share that. Future items as well. I've noted these down on the 28th of March as well, but having one's on patient transport and one is around GP surgery commissioning. Now, I met with Claire Parker, who is the Director of Commissioning at the CCG on these topics, and it's quite clear that I think trying to get large pieces of work from the CCG anytime before June is going to prove to be rather difficult. We were meeting them with a view to preparing work for the Joint Health Level Scrutiny Committee, and I think any attempts to try and bring any sort of briefing or preparatory work to June were met with raised eyebrows. I think mostly because of the nobody really knows that they're going to do post in June because they're under a significant restructure at the moment within the CCG. But those two topics still sit on the agenda. So really what I ask at the moment is your thoughts on those first two items that are within our gift, those on joint commissioning and winter plan. I would also remind you that at your meeting before Christmas, you asked to bring Bishop's Castle Community Hospital back to the committee. So it's some instruction on what you want from that would be most useful as well, so I can forward that on to the relevant officers.
Thanks, Daniel. A couple of people coming in. Nick?
Yeah, thank you, Chair. I think Daniel's kind of slightly taken the wind out of my sail, which I'm pleased about, because it did seem to me that the end of March meeting was incredibly heavily loaded, and I would certainly be extremely interested in Claire Parker's report. So it's reassuring that that's probably going to be the July meeting from what Daniel's saying, because it seemed to me that if we were going to look at all of those things, plus the winter plan, plus the joint commissioning, we'd need a sort of 6-hour meeting. I mean, I, for one, would have a lot of questions and points to raise. I'm sure Heather would, and probably the other members of the committee. So that's very reassuring. Thank you.
Yeah, there were a lot of discussions about trying to spread things evenly throughout the next few meetings. So we hope we've got somewhere near. Heather?
Yes, for the next meeting, I'm concerned that it isn't just winter pressures we're looking at, because adult social care, from my experience locally, is suffering, as we are across the country, with a lack of staffing, people coming forward to be PAs and so on. And I think alongside the winter pressures, this isn't just about winter pressures, this is a real problem in staffing care homes, people working in the community and so on. And I always feel really guilty when I have to ask social services to find somebody to help someone, because there is no one at the present time, and it's just been, we will find what you want as soon as we can. So there's obviously a big problem, which is nothing to do with us as a council, but we need to find a way to plan through that. And so staffing, levels of remuneration, all of those things around both children's and adult social care, I think is a really important part of all of that. And it's a big piece of work, but it actually sits alongside the winter pressures, because it's been fundamentally difficult this winter. I may be wrong, Tanya, but we need to be as supportive as possible to find a way through that, because it's not great for any of your staff who are really stretched at the moment.
Tanya, do you want to come back?
Thank you, Heather, for raising that. So it's really helpful on the 28th of March to have both the winter plan and also Laura Tyler coming along talking about joint commissioning, and we can certainly make sure that within that conversation we talk about market capacity.
Thank you. So the patient transport, is that still on the item for the 28th? Because we did start to talk about that in 2020, and this probably links in with our previous item we've spoken about today, because the inequalities in the rural areas with patient transport, apparently we've got none in Ludlow whatsoever. It's non-existent trying to get to Princess Royal Hospital. There's no direct link. Patient transport is impossible to get, so I'd be really keen to see that. It's quite a small item in some respects, but it does link in with our previous item that Rachel and Steve have been talking about, health inequality. So I would like to do that if possible.
Yeah.
If possible.
Oh, absolutely. I think when I originally explored this last year, I think at that time the contract was out to tender, so obviously they didn't want to come while it was out to tender. Then I think there was a delay in the tendering process, so they didn't want to come for that. And then they, quite reasonably said, well, we need to give the contract a little time to bed in order to be able to comment on it meaningfully. All of this obviously doesn't really get us any further close to scrutinising something which is clearly not delivering for people in Shropshire, and furthermore doesn't seem to be working particularly well with what patchwork community services that we have. And when I compare that to our health colleagues in Wales, it causes me to pause a little. So I would absolutely agree with this coming to a committee as a topic. I think that the issue is around actually bringing them to the committee in a way that is meaningful. And I don't. It's a hard balance for me as an officer. You see, if I can demand that Claire attend the meeting, but she'll probably ignore me. Or she will come, but she won't produce the work that you want to do. So, but if the work that we want to do this justice will probably not happen until later in the year. So I'm in a bit of a paradox on that. I'm not really quite sure how to deal with this. We can bring it in March. We can bring it later in the year. It's down to you really. I'm just sort of advising you on how I'm finding bringing this to the committee.
It's just I don't want it put back again and again and again and again, because it is crucial for the health inequalities in the rural areas, and we really have got to get to grips with this. I think it just links in with your public health thing.
I don't think it's not intended to keep pushing it back, but I think we need to interrogate it at the right time.
I'll go by Daniel's instruction then.
Thanks, Trish.
I think Daniel wanted instruction around Bishop's Castle Hospital, so
I very much so,
that,
yes. I think that's the thing.
But actually, on that, surely this should be part of the transport plan.
Yeah, so yes, I just read, yeah.
Under Steve, because he needs to work, because we have patchy dialer rides and patient hospital cars, very patchy. So, there are odd areas that have ordinary cars, that voluntary cars, but many areas, mine included, have none of that. And we can only go to Shrewsbury.
And you could, the community service committee looked at this a couple of years ago. We didn't really get very far with it, and I think there is obviously a lot of this isn't necessarily in our gift, and we can rail against the contracting arrangements of the CCG, but there's very little that we can do about it. But what is in our gift is our contracting arrangements with our community transport services. And the one thing that was quite clear from the community overviews committee's work is that it's very patchwork and it's very idiosyncratic, and it's not necessarily desperately effective. But that's the situation when you're dealing with working with volunteers and voluntary groups. You don't have that same hold over them than you do with a paid service. But nonetheless, that's what we're relying on. We're relying on community services to plug the gaps in passenger services. So you could argue that that's certainly within your gift to scrutinise those and how those relate to passenger services. But you're right, I think that needs to be looked at the wider context of transport.
Right.
Yeah, yeah.
If I can come back then to Bishop's Castle Hospital. So far, and we have had meetings with Patricia Davis. I'm not sure exactly how far it got us. She's now having separate meetings with all sorts. I'm not sure that's particularly helpful either. I do think every group needs to be in the room together, whether it's online or whether it's physically, because otherwise different things are raised with different people, and far be it from me to say it leads to dividing and ruling, but it might. So Ruth, Nigel and I are trying to move this on so that we're actually working all together rather than separately. And the Friends of the Hospital, or they're not called the Friends of the Hospital, but the hospital voluntary group that works with the hospital, are having private meetings and we're trying to bring the GPs in and so on, but we can't do any of this unless we're all together and have a common purpose around it. I was also slightly concerned that we were told that there were adverts out to recruit across the board. Well, the advert that I was sent, it was a PDF, it's really difficult to put on Facebook. One of them I could not JPEG, it wouldn't allow me to. I've asked for them to JPEG it, I've never had an answer. I've had, the one I can JPEG wasn't about nurses. It was about healthcare assistants and training and so on, which is all great stuff, but it was across the whole of the county, and that's absolutely vital. But actually we need nurses. So there are some issues here that I'm a bit concerned about, but this morning I've now got the advert from a link, which is huge. I'm going to actually have to make this advert into something I can put onto Facebook. This is just not good enough. This is why they don't recruit. It's really poor. So we do need a report back from them about where they've got to with the community, how they work with all the community groups together to get anywhere. And I suggest it won't be the end of March at this rate, but actually we need to have a report back on how successful their various recruitments are going to be. There is a specialist one at the beginning of April, which is the one I've just got this online advert for on the website.
So when they come back in March, are you asking for an update from them on their recruitment methodology or process?
I'm not sure, and I think we need to talk about this, whether they're going to be in a right position in a month's time to actually say where they've got to with the community. And their first recruitment for Bishop's Castle isn't until I think the 8th of April. So it may well be that we need something after that, but it does depend on them, I'm afraid, actually working with us to go through the recruitment, because we know of people who would like to apply and they say, oh, it's on the website. No good. We need to be able to get it out through our Facebook groups, not our email lists. We need to share it all over the place and encourage people to come to Bishop's Castle with a bit of an advert. And if I send an email, I get nothing back. So they need, and we need, a bit of an input into, so do you really want to recruit?
So, Daniel, do we need to pump that back a month then?
We certainly can, Chair. At the moment, I think we have one meeting in March, at the end of March, and then again in June, but there's no reason why we can't. We have postponed meetings, so there's no reason why we couldn't invite them to a specific meeting in April or May, for example, or if you wanted to do that meeting online to reduce the sort of burden of costs, we can do that, though obviously that meeting is not then in public, so you know, there's swings and roundabouts.
I think it needs to be in public because there's so much local concern about it, but I think the very things I've just been talking about recruitment goes for Whitchurch, Bridgenorth, Ludlow. You know, they have to up their game a bit. And I know it's difficult, but it's no good in a difficult climate just doing a bog standard attempt and saying, oh dear, we can't do it.
It's useful hearing that as a sort of standard inquiry, isn't it? Because we don't want to invite them back here and just have a scattergun approach, and we won't get anywhere with that. So.
But can I say, the last meeting, we asked questions such as remuneration, can we pay them any more money? And we'll look at that, or can we pay them a welcome bonus, a recruitment bonus or whatever, because they were competing with the whole country, and they had accommodation problems, they had to give something to tempt people to come. We asked those questions. I've never had any answers on that, and maybe we should get answers on that, and I'd like, as Heather said, a meeting in April or whatever, so we have an update specifically on that problem.
We can wrap that all into the recruitment side of it. Okay, so we've got a bit of a refined way. David.
One of the big issues, we all know, during the pandemic, which brought to great prominence, is mental health. And I was wondering whether sometime later in the year we would look in some aspects of that because it's so important.
don't see why not, potentially later in the year.
Yeah, I think the People Overview Committee has embarked on that piece of work as a priority. The chair and the exec director met last week, and they've agreed to bring that forward as a matter of urgency onto their work programme.
Okay. So it sounds like we've got a busy meeting in March, whatever.
Yeah.
Okay.
Sorry, Chair,
I see you
Chair,
done that.
there's a lot going on. When are we going to bring anything back about the ambulance service and the A&E? And I know Joint OSC is going to probably be the conduit for looking at this. But I did ask at full council, and I think it was sort of agreed, that we would have a select committee to sort of look more in depth, because obviously staff and West Midlands ambulance service are not talking to each other, and there's a problem with both of them. But we really need to be scrutinising this now. So I just wondered, later in the year, if we've got any.
I can reply to that. I'd like to, if I might as well indulge me, a challenge to the group as well, to the committee. Obviously the Joint Health Committee looked at this at quite some length last December, but in my opinion it didn't really do anything with the opportunity in front of it. There was lots of righteous anger and frustration at the service, but there wasn't really any resolution going forward as to how the committee or how the local authority might ameliorate that in any way. There was a broader conversation around how ambulance services fit within the broader system, but it made no recommendations. So I can bring it back to the committee. We can suggest to bring it back, but for what purpose?
That's not quite right. Because if you remember, what we asked for was the plan to clear the ambulances from the hospital, and there was meant to be a detailed plan.
Yes, there was that.
And that is part of this whole thing. Yeah. And actually, on a Tuesday afternoon, when Ruth and I were at the hospital, there were 10 ambulances outside about 3 weeks ago. So nothing has changed. And we do need to have that plan back. We do need to know how and there were questions asked. I asked them to reply to me around, are they doing 24/7 care at the hospital, because that helps to clear beds. I specifically asked a number of questions at that scrutiny committee that they were meant to be coming back with. And I know they're not doing 24/7, because I actually had a member of my division, resident in my division, who was stuck in hospital all weekend because he couldn't get his pharmacy. There wasn't a pharmacist available. He was just doing, nobody doing pharmacy for discharges. My daughter was stuck there because her son needed a complex scan on his kidney, and she was stuck from the Friday until the Tuesday. They are not doing a 7-day-a-week service, and until they do, and if you remember, I also raised the clerical staff on wards and so on, so that we didn't have team leaders doing the tea, answering the phones, so that they were actually doing the nursing and getting people out of beds. So all of those things will free up beds from A&E and clear the ambulances. We had no responses to any of that, and I did ask specifically.
No, that's a very fair point, and indeed we've asked repeatedly for those extra documents. They're just not forthcoming. We get, first of all, it's we can't share them because they're confidential. Then it's we can't share them, but we don't want them published. Fine, we won't publish them. Then they still don't share them, and we've asked and we've asked and we've asked and we've asked and we've asked. So I think all we can really do is we could write to them. We could ask them. The committee could write to ask for that additional information. But if I might. I think the topic you're referring to, I mean, you're right, this is all interrelated, ambulances, A&E and so on. The two chairs, as in Councillor Chandler here and Derek White from Telford and Reekin, met last week to try and unpick how to scrutinise this within Joint Health going forward. And this follows on from our meetings with Claire Parker last week, and what we're proposing to do within the Joint Health Committee, and there'll be an email about this in the next day or two, and we're going to discuss this within our planning meeting for Joint Health at our next planning meeting, is we're proposing to sort of form 2 work streams for the Joint Health Committee going forward, one on primary care and one on urgent care. Because we realise that at the moment, whenever we bring a specific aspect of this, it spins off onto the other interrelated topics, quite understandably, but the result is that we're kind of losing focus a bit. So we'll talk about ambulances, but then we'll talk about accident and emergency at SAF, quite reasonably, but it did distract attention from the first topic. So what we're proposing is that we're going to hold a series of briefing sessions looking at these topics individually but in relation to each other before bringing them as discrete topics, one on urgent care and one on primary care, to the joint health committees later in the year. This is the planning work that we were doing with Claire, so we were planning to start these briefing sessions in June and then taking them forward so we can look at these topics within the context of the broader issue around primary care, without primary care being such a big topic that we don't really do anything meaningful in the meeting.
Yep. With all due respect, the ambulance issue is now really urgent. I mean, we have people lying on floors for 10 hours with broken hips, people dying as a consequence because they go to hospital and they're seriously unwell. We have to begin to be much more strident about the turnaround times of ambulances and the numbers of ambulances we've got. It's not something we can keep kicking into the long grass. And if they don't answer us, we go further. We actually have to take it to the minister. We have to go somewhere with this, because just having people refusing, and we do have a joint HOSC, a statutory right to the answers.
Yeah.
We need to now escalate that, because it's not acceptable anymore. It's really not acceptable. For many, many years, it's not been acceptable in my division. I've never, ever had a single target ever met. Ever. If you have a stroke that's in waiting 3 or 4 hours, and then somebody from the hospital telling me that actually the golden hour doesn't matter, this is completely crass and unacceptable. But we've now reached a point where we do need to do something, and we do have to refer this to MPs and ministers, because it's not good enough, and we can't just have it kicked into the long grass.
I don't think it's the point of kicking into the long grass, Heather. We had a lengthy description, as Daniel said, last week with Derek, co-chair of Joint HOSC. We've got the planning meeting tomorrow, and there is a series of meetings and Dan said, briefings on this to get everyone up to speed on it, so we're all at the same place, and then we can go and interrogate it. What I don't want is a sort of scattergun approach with people with misconceptions and different levels of knowledge. We've got to hit this hard, and we're willing to do that, but we can't do it overnight without having the knowledge first.
I will be at the planning meeting, as you would expect.
Absolutely.
But
you say the same thing.
I will. The point here is we've now got the public really upset, so we have to be representing those people as well, and seem to be doing that, and not just at Joint HOSC, but here too.
Can I just add in there? We have 3.
Same thing.
Yeah, we have 3 campaigns around Shropshire, individual campaigns, one in Bridgmoor, one in Ludlow, Bishop's Castle. They are gaining power as we speak. They've got a lot of power behind them. We've got meetings with the MP in Ludlow on Friday. All I'm asking is, and with Scrutiny is being criticised by members of the public locally, in my division is not having any teeth, not having any weight, not doing anything. Shropshire Council is being criticised every day. I receive emails saying, what is Scrutiny doing? What is Scrutiny doing about it? Because this campaign is gathering momentum, and it's a serious campaign. Don't underestimate the public. They will be here every meeting, banging on the door, sending in questions, campaigning outside. All I'm asking, I totally understand, Chair, what you're saying. We've got to get all of it together, because it's not constructive if we don't. But Scrutiny has got to be seen to be doing something to reassure the public that you are looking into it. We are working together. Because at the moment, all I'm getting from the public is, what is Scrutiny at Shropshire Council doing? It's a committee that doesn't do anything. It doesn't go anywhere. It doesn't have any teeth. And that is the bit I don't want to be hearing from the public, because this is, as Heather said, this is a big campaign, and probably one of the biggest that I've seen in my time on Shropshire Council.
If I might, and forgive me, I'm not entirely comfortable with the tone of this conversation in terms of the Scrutiny Committee. We're veering into campaigning here, and that's not our role.
That's not what I was saying.
And that's not what I'm saying, and I'm just pre-warning that actually this is what I'm getting. I don't want to be hearing this from the public. I'm defending Scrutiny Committee. I'm telling them all the good work we do, but I get this every day. They're on my case all the time. So I'm just asking, can Scrutiny Committee give something to reassure the public, It's not coming from me. It's not me saying this. This is what I'm getting.
This isn't about campaigning, it's about Scrutiny actually doing something and seem to be doing something. Whether it's what they want or not is a different thing, but we do need to be seen.
That's what I'm trying to say.
Okay.
Yeah.
So what is it you actually want to achieve? What's your objective here?
Possibly with Scrutiny Committee, I want to be seen that we're asking the questions of the right thing. We're talking to Sam, we're talking to West Midlands Ambulance Service. They're coming to a meet. The chief executive is coming on Monday to a meeting in Ludlow Town Council. They're talking to him. We've got to be seen to be asking the questions, and then we'll get it all together. And you can, all the background
Yeah,
stuff.
and forgive me for challenging. I just want to sort of. I'm only challenging.
I
Just so
think
we
the public would be happy with that. They just want to see things.
So you want to talk to for what purpose?
To ask the questions, to ask.
For what purpose? What? That's what I'm saying. Then what's your objective here? It's just getting to the table to talk. Then that's not. We can do that. That's very easy. But
the
for what
overall
purpose?
objective of mine has been for the last 15 years is actually to improve the response times for us, but it has lots and lots of different legs to it. It is about improving, and it's not something new to me. I literally, the people who know me over the last 15 to 20 years will know I've been doing this for many, many years. It's improving response times in rural areas.
Right, Chris.
Thank you, Chair. Nice to get a word in. I think we're putting the officer in a very difficult position here.
We just got.
All we can do is ask the officer to invite somebody, and then I'd like to know what the purpose is, because I thought this was a scrutiny committee. So when we do get somebody here, then what are we going to scrutinise? I want to say things about Osler Street. I mean, the demographics of Osler Street, where classed as the West Midlands, I mean, we might as well be in Wales, because it doesn't exist. So I mean, Bishop's Castle, Ludlow, the whole area of Shropshire is a nightmare. But if we get the West Midlands Ambulance Service here and everything, I quite agree with the officer. What are we scrutinising?
It's a very fair question. Go on, Rachel.
I thought I just answered it.
Yeah, I think, what I was going to say is what I'm hearing very loudly is that clearly this needs to be brought back to joint task. Need to bring this back and have a full and a detailed debate on it, and ask the questions of why the actions from the previous meeting weren't followed through. But you've got a planning session that's coming up where the detail of the key lines of inquiry will be worked out in the ask, which has just been articulated, can clearly be put back to the ambulance service and also staff who need to be in those conversations. So I agree with that wider urgent care conversation, because they are interlinked, but you need those key lines, which will be discussed, I believe, at the planning meeting. I think what members are saying is there's a real strong desire to be brought back. Absolutely needs to be brought back to HOS. I think colleagues have raised other issues. There is other big issues that are coming up in our area that need to be addressed, probably through joint HOS, thinking of maternity services again. There's probably some key questions there. And then back to this meeting, I think the issues around Bishop's Castle, we do need that extra meeting because there's so much on the agenda that we need to get through. Is kind of what I'm hearing and sort of suggesting that perhaps that we could bring back and discuss. And I think there was, I'm just going to raise, sorry, I think there was a couple of, obviously we talked about health impact assessments, bringing those back, but I did, there was one other thing that I just wanted to mention. I think it was around, we did say it as well, so just to mention two other things. The Health and Wellbeing Board have also agreed to look at the issues around ambulance services, and we need to understand what their role is going to be. And the final bit that was to bring in was just around the primary care, because I do agree that whilst perhaps it's something that we need to understand the direction of travel, the strategy around primary care, which we've been asking for some time, but there's some local issues that we also will need to address, and I think again have been raised that are really for Scrutiny, which is some of the work that's going on around Shrewsbury Health and Wellbeing Centre. Again, once that comes to a critical point, I believe that probably needs to be on the work plan as well. And I suppose what I was trying to do is just separate out what we think needs to go to joint HOS, what needs to come here, but I agree this is a really important function, and perhaps some of these detailed conversations we could take offline and have in those planning meetings, because I think the point is made that we need to be really homing down on what we need to be, what we should be, what we can do as a Scrutiny committee. That's just.
It's a big beast, and there's a lot of strands to it which we need to get right. Kate, you wanted to come in?
I think it's largely been dealt with now, but I mean, just to go back to, I think there is something in the principle of just not getting information back, and I think that's where we really do need to continue to pursue this. There's a lot of understandable upset in this issue. You know, there are people in a lot of pain, the deaths, etc. But I think if the joint HOSC can pursue that, somebody needs to be seen to be pursuing that with the ambulance service.
And just to add to this, there is a grave misunderstanding about the difference between our Health and Adult Social Care Committee and the joint HOSC. The public don't understand that there is a considerable difference, and that joint HOSC has a statutory role, whereas ours is a council role.
Yeah.
So I think there's a communication issue there, so that we actually begin to diffuse some of it and make sure that the questions the public want to ask go to joint HOSC, not here.
That's exactly correct, Angela, and that's what I was trying to say, that actually can we reassure the public and steer them in the right direction.
I would totally agree with that, and it's a shame, I think, that the Joint Health Scrutiny Committee doesn't have the function that we have here, whereby members of the public can ask questions and contribute. You know, the quality of questioning, public questioning that we get for this committee is startlingly high. I don't, you know, but perhaps this is a conversation tomorrow when we have a planning committee meeting about whether that or not that committee can carve out some space for this sort of discussion, because personally I thought that the quality of discussion before Christmas in Bishop's Castle was quite high, and they were very frank and open with us, and I would like to see that, although it was, you know, serendipitous that it happened. I'd quite like to see that level of engagement happen at joint committee, because it just doesn't really. It happens here, but it doesn't seem to happen there for some reason. I'm not sure why. Roy.
Yeah, just one thing about this. I've got coming on the ambulance thing. One of the questions that could be asked, I think, is what happened to the community first responders?
Yeah.
Because West Midlands Ambulance Service seems to have done something to upset most of them across the county, which is why the whole system has broken down in terms of the first responders. And secondly, we have quite a number of St John and Red Cross units in villages and towns in the county, and I don't see them figuring in any of the possible solutions to some of our problems, like, for instance, in London, where St John and Red Cross vehicles with fully trained people are on board, but volunteers are answering calls because there are no NHS ambulances available. So I think if we were going to have an ambulance service person here, we need to be asking the question about first responders, community volunteer first responders and their training, and why that stopped, and also whether we should be using St John and Red Cross volunteers, and possibly even private ambulances would exist within Shropshire. Thank you.
Thank you, Roy. We'll take that on board, I think. But I think we've got plenty to go on there, Daniel. And a lot of it will come back tomorrow when we're at the planning meeting for Shropshire.
Yeah, just a very quick reminder to Heather and Kate about that meeting tomorrow, so there's loads to go through. Quite excited by that.
Okay. Date of the next meeting, 28th of March, Monday at 10 o'clock again. So thank you, everybody. Meeting closed.